Welcome to Step Up Startup, a guide for patients starting Otrexup, methotrexate injection for subcutaneous use. This video guide will provide you with the helpful information you need to get started with your Otrexup treatment. The chapters of the guide include how to self-administer Otrexup and important information about Otrexup. Important safety information, including boxed warning, will be reviewed immediately after the instructions for use. Okay, let's get started. Chapter 1. Let's take a look at how to administer Otrexup methotrexate injection for subcutaneous use. Before you take Otrexup, tell your doctor if you have any other medical conditions. Tell your doctor about all of the medicines you take, including prescription medicine, over-the-counter medicines, vitamins, and herbal supplements. Now we'll take a closer look at how you can administer Otrexup on your own. After watching this video and receiving training by your healthcare provider, you will be able to confidently self-administer Otrexup in the comfort of your own home. Before you administer Otrexup, be sure to read the full instructions for use and patient information included in the full prescribing information. First, you must prepare to use Otrexup. Wash your hands with soap and warm water. Check the expiration date on the label. Do not use if expired. Check the seal. Do not use Otrexup if the seal is broken. You will also need the following items: 1 alcohol swab and 1 cotton ball or piece of gauze. Next, check the liquid. This can be done by looking at the viewing window. The liquid should be yellow in color and not have any lumps or particles in it. You may see an air bubble. This is normal. Do not remove the cap marked 1 or the safety clip marked 2 until you are ready to use Otrexup. Finally, you must choose an injection site. Otrexup should be injected into the stomach, also known as the abdomen, or thigh. Make sure to inject in a different place on your stomach or thigh each week. Do not inject Otrexup within 2 inches of the belly button or navel. Do not inject Otrexup into the arms or any other areas of the body. Do not inject Otrexup where the skin is tender, bruised, red, scaly, hard, or has scars or stretch marks. Wipe the area with an alcohol swab. Allow the skin to dry and do not touch this area again before injecting Otrexup. Do not fan or blow on the clean area. Giving yourself the Otrexup injection is an easy 5-step process. Let's start with step 1, removing the cap. Twist the cap marked 1 to remove. This will break the seal. You may notice 1 or 2 drops of medicine. This is normal. Do not touch the needle end with your hands or fingers. This could inject the medicine into your hand. Do not replace the cap after it has been removed. After the cap is removed, Otrexup must be used or disposed of safely. We'll touch on how to dispose of Otrexup in a few more minutes. Step 2. Remove the safety clip marked 2. Step 3. Gently place the needle end of Otrexup against your thigh or stomach at a 90-degree angle and firmly push until you hear a click. Continue to hold in place and count slowly. 1, 2, 3. After counting to 3, remove Otrexup from the injection site. You may notice a small amount of blood or liquid at the administration site, which is normal. Press a cotton ball or piece of gauze on the area for 10 seconds. Do not rub the area. Step 4. Check the viewing window. The viewing window will turn red to show that the medicine was given. If the viewing window is not blocked, did not turn red, call your doctor or pharmacist, or call 1-855-OTREXUP, 1-855-687-3987 for help. Do not use another Otrexup injector without talking to your doctor. Step 5. Dispose of Otrexup. Do not discard your used Otrexup auto-injector in your household trash. Place it in a Sharps disposal container right away after use. Antares Pharma is offering a disposal program for your used auto-injectors. To receive this Sharps disposal container, please call 1-855-OTREXUP, 1-855-687-3987, or sign up at www.otrexup.com. If you do not sign up for the Antares disposal program, you may use a household container, provided it is made of heavy-duty plastic, can be closed with a tight-fitting, puncture-resistant lid without the ability for the sharps to come out, is upright and stable during use, is leak-resistant, and is properly labeled to warn of hazardous waste inside the container. When your household sharps disposal container is almost full, you will need to follow your community guidelines for the right way to dispose of your container. There may be state or local laws about how you should throw away used needles and syringes. For more information about safe sharps disposal and for specific information about sharps disposals in the state that you live in, go to the FDA's website at www.fda.gov/safe-sharps-disposal. Do not dispose of your sharps disposal container in your household trash unless your community guidelines permit this. Do not recycle your used sharps disposal container. Safely dispose of Otrexup that is out of date or no longer needed. Important safety information. Please listen closely to the following Otrexup indications and important safety information, including boxed warning. Otrexup methotrexate injection for subcutaneous use is a single-dose auto-injector containing a prescription medicine, methotrexate. Methotrexate is used to treat certain adults with severe active rheumatoid arthritis and children with active polyarticular juvenile idiopathic arthritis after treatment with other medicines, including nonsteroidal anti-inflammatory drugs, have been used and did not work well. Control the symptoms of severe resistant disabling psoriasis in adults when other types of treatment have been used and did not work well. Otrexup should not be used for the treatment of cancer. Otrexup should not be used for the treatment of children with psoriasis. Otrexup can cause serious side effects that can lead to death, including an increased risk of death from organ toxicity. Types of organ toxicity can include gastrointestinal, bone marrow, liver, immune system, nerve, lung, kidneys, and skin. Women who are pregnant are at increased risk for death of the baby and birth defects. Women who are pregnant or who plan to become pregnant must not take Otrexup. Contraception should be used by both females and males while taking Otrexup. For males, pregnancy should be avoided for a minimum of 3 months after treatment with Otrexup, and for females, for at least 1 menstrual cycle after treatment. Do not take Otrexup if you are pregnant or planning to become pregnant. Are breastfeeding. Have alcohol problems. Have liver problems. Have problems fighting infection. Have a blood disorder. Have an allergy to methotrexate. Possible side effects of Otrexup: fertility problems, certain cancers, tissue and bone problems. Common side effects of Otrexup include nausea, stomach pain, indigestion, mouth sores, and rash. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information, go to www.otrexup.com or call 1-855-OTREXUP, 1-855-687-3987. Chapter 2. Important information about Otrexup methotrexate injection for subcutaneous use. Approved uses and important safety information, including boxed warning. Otrexup methotrexate injection for subcutaneous use is a single-dose auto-injector containing a prescription medicine, methotrexate. Methotrexate is used to treat certain adults with severe active rheumatoid arthritis and children with active polyarticular juvenile idiopathic arthritis after treatment with other medicines, including nonsteroidal anti-inflammatory drugs, have been used and did not work well. Control the symptoms of severe resistant disabling psoriasis in adults when other types of treatment have been used and did not work well. Otrexup should not be used for the treatment of cancer. Otrexup should not be used for the treatment of children with psoriasis. Methotrexate includes the following boxed warning. Otrexup can cause serious side effects that can lead to death, including organ system toxicity. People who use methotrexate for the treatment of cancer, psoriasis, or rheumatoid arthritis have an increased risk of death from organ toxicity. Types of organ toxicity can include gastrointestinal, bone marrow, liver, immune system, nerve, lung, kidneys, and skin. Your doctor will do blood tests and other types of tests before you take and while you are taking Otrexup to check for signs and symptoms of organ toxicity. Call your doctor right away if you have any of the following symptoms of organ toxicity: vomiting, diarrhea, mouth sores, fever, confusion, weakness, temporary blindness, seizures, headache, back pain, neck stiffness, paralysis, irritability, sleepiness, problems with coordination, dry cough, trouble breathing, and severe skin rash. Women who are pregnant are at increased risk for death of the baby and for birth defects in the baby. Women who are pregnant or who plan to become pregnant must not take Otrexup. A pregnancy test should be performed before starting Otrexup. Contraception should be used by both females and males while taking Otrexup. Pregnancy should be avoided if either partner is receiving Otrexup for a minimum of 3 months after treatment with Otrexup for males, during and for at least 1 menstrual cycle after treatment with Otrexup for females. What are the possible side effects of Otrexup? Otrexup may cause serious side effects, including fertility problems. Methotrexate, the active ingredient in Otrexup, may affect your ability to have a baby. Males may have a decreased sperm count, and females may have changes to their menstrual cycle. This can happen while taking Otrexup and for a short period of time after you stop. Certain cancers. Some people who have taken methotrexate have had a certain type of cancer called non-Hodgkin's lymphoma and other tumors. Your doctor may tell you to stop taking Otrexup if this happens. Tissue and bone problems. Taking methotrexate while having radiation therapy may increase the risk of your tissue or bone not receiving enough blood. This may lead to death of the tissue or bone. Common side effects of Otrexup include nausea, stomach pain, indigestion, dyspepsia, mouth sores, and rash. Who should not take Otrexup? Do not take Otrexup if you are pregnant or planning to become pregnant. Are breastfeeding. Otrexup can pass into your breast milk and may harm your baby. Have alcohol problems, alcoholism. Have liver problems. Have problems fighting infection, immunodeficiency syndrome. Have been told you have or think you have a blood disorder, such as low levels of white blood cells, red blood cells, anemia, or platelets. Have had an allergy to methotrexate or any of the ingredients in Otrexup. What should I tell my doctor before taking Otrexup? Before you take Otrexup, tell your doctor if you have any other medical conditions. Tell your doctor about all of the medicines you take, including prescription medicines, over-the-counter medicines, vitamins, and herbal supplements. Otrexup may affect how other medicines work, and other medicines may affect how Otrexup works, causing side effects. Ask your doctor or pharmacist for a list of medicines if you are not sure. Tell your doctor if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Otrexup. For more information, ask your doctor or pharmacist. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information, go to www.otrexup.com or call 1-855-OTREXUP, 1-855-687-3987. Please see the patient information in the full prescribing information. Otrexup is an innovative auto-injector that contains a prescription medication called methotrexate. Methotrexate is one of the most commonly used medications for the treatment of rheumatoid arthritis. Methotrexate pills and injection have been used by healthcare professionals in the United States for over 20 years. Otrexup has been made specifically for patients with rheumatoid arthritis. Otrexup comes in 4 strengths: 10 milligrams, 15 milligrams, 20 milligrams, and 25 milligrams. Your healthcare provider has prescribed the strength that they believe will work best for you. Let's look at some of the benefits of Otrexup. The Otrexup auto-injector makes it easy for you to handle and administer your medicine. In a clinical study, 98% of patients with RA agreed that Otrexup was easy to use. One recent clinical trial showed that patients were able to absorb more methotrexate from Otrexup than patients taking methotrexate pills. Other published studies indicate that patients who switched to an injection of methotrexate from methotrexate pills may experience an improvement. In addition, studies have shown that many patients who did not respond well to methotrexate pills because of side effects were able to better tolerate injectable methotrexate. Experience in children suggests similar results: better absorption by the body and fewer gastrointestinal side effects with an injectable. The Otrexup auto-injector includes a number of features to help you feel comfortable and confident in using the device. If you have a fear of needles, Otrexup is designed for you because the Otrexup needle is hidden before and after the injection. Remember not to touch the needle end to avoid accidentally injecting the medication into your hand. In the same clinical trial that demonstrated Otrexup was easy to use, patients also experienced minimal injection site pain. The Otrexup injector provides a needle cap and safety clip that locks the needle guard to protect you from accidental needle stick injuries. Because Otrexup comes pre-filled, you can be assured that you are getting an accurate dose of the strength your doctor has prescribed. Finally, Otrexup is stored at room temperature, so no refrigeration is required. It is important to keep your injector at room temperature and protected from light. If in doubt, please contact your pharmacist or Antares Pharma at 1-855-Otrexup, 1-855-687-3987. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information, go to www.otrexup.com or call 1-855-Otrexup, 1-855-687-3987.